Herpes simplex virus or HSV is a common viral infection. It impacts millions of people worldwide and is a significant public health concern. Understanding HSV is essential for medical professionals, as it is frequently tested on exams like the NCLEX. This essay provides a comprehensive overview of HSV. We will delve into its types, transmission, clinical presentation, and more. Our goal is to equip future healthcare providers with the knowledge to manage HSV effectively. We aim to improve patient care and education surrounding this prevalent virus. There are two main types of herpes simplex virus, HSV-1 and HSV-2. HSV-1 is typically associated with oral herpes, commonly known as cold sores or fever blisters. HSV-2 primarily causes genital herpes. However, it's crucial to understand that both types can infect either site. This means HSV-1 can cause genital herpes, and HSV-2 can cause oral herpes. Transmission occurs through direct contact with infected individuals. HSV can spread through saliva, genital secretions, or even skin-to-skin contact. A critical point to remember is asymptomatic shedding. People with HSV can transmit the virus even when they don't have visible symptoms. This makes prevention and education crucial in controlling the spread of HSV. The initial HSV infection, known as the primary infection, often presents with more severe symptoms. These can include painful ulcers or blisters, fever, swollen lymph nodes, and flu-like symptoms. However, some individuals may experience mild or even no symptoms during the primary infection. Following the primary infection, HSV establishes latency in the body. This means the virus remains dormant in nerve cells. Recurrent outbreaks can occur, triggered by factors like stress, illness, or sunlight. These outbreaks typically present with milder symptoms than the primary infection. Prodromal symptoms like tingling or itching at the site of infection often precede the appearance of blisters. It's crucial to remember that HSV can be spread even in the absence of visible sores. Diagnosing HSV involves a combination of clinical evaluation and laboratory testing. Healthcare providers consider the patient's medical history, sexual history, and physical examination findings. Laboratory tests play a vital role in confirming the diagnosis. Several methods are available to diagnose HSV. Polymerase chain reaction or PCR testing is considered the gold standard, especially for active lesions. PCR detects the virus's DNA and can differentiate between HSV-1 and HSV-2. Other tests include the Zank smear, which examines cells from the lesion under a microscope, and serologic tests, which detect HSV antibodies in the blood. Section 5. Treatment options for HSV. While there is no cure for HSV, antiviral medications effectively manage the infection and reduce symptoms. These medications work by interfering with the virus's replication cycle. Commonly prescribed antivirals for HSV include acyclovir, valacyclovir, and famciclovir. Treatment approaches vary depending on the individual patient and the severity of their infection. Episodic treatment involves taking antiviral medication at the first sign of an outbreak or prodromal symptoms. This helps shorten the duration and severity of the outbreak. Suppressive treatment, on the other hand, involves taking daily antiviral medication to prevent outbreaks altogether. This approach is often recommended for individuals with frequent or severe outbreaks. While antiviral medications cannot eliminate the virus, they significantly improve the quality of life for individuals living with HSV. Section 6. Complications and special considerations. While generally manageable, HSV can lead to complications in certain populations. Pregnant women with genital herpes require careful monitoring, as the virus can be transmitted to the baby during delivery. Neonatal herpes can have serious consequences for the newborn. Cesarean section is often recommended for women with active genital herpes lesions or a history of genital herpes near their due date. Immunocompromised individuals, such as those with HIV/AIDS or undergoing chemotherapy, are also at increased risk for complications from HSV. These individuals may experience more severe outbreaks, longer healing times, and a higher likelihood of the virus spreading to other parts of the body. Close monitoring and individualized treatment plans are essential for managing HSV in these populations. Section 7. Prevention and patient education. Preventing the spread of HSV involves a combination of individual responsibility and public health measures. Condoms, while not foolproof, can reduce the risk of transmission during sexual activity. Avoiding contact with HSV lesions and sharing personal items like razors or lip balm is crucial. Patient education plays a vital role in HSV prevention and management. Healthcare providers should counsel patients on recognizing the symptoms of HSV, understanding transmission routes, and practicing safe sex. Open communication about HSV status with partners is essential. Section 8. Conclusion. Living with HSV. Herpes simplex virus is a common lifelong infection. While there is no cure, effective treatment and management strategies can significantly reduce symptoms and improve quality of life. Understanding the different types of HSV, transmission routes, clinical presentation, and available treatments is crucial for healthcare providers. By staying informed and providing compassionate patient care, we can help individuals navigate the challenges of living with HSV. Remember, knowledge is power when it comes to managing this prevalent virus.